All right, awesome. Okay, so what we wanted to look at is high-grade serous ovarian cancer patients. Despite serving as like the first-line treatment, which is platinum-based chemotherapy, roughly 20% of patients do fail to respond to that. And so when we look at other cancers, quantitative pathologic biomarkers offer a potential low-cost approach to assess for this use case for platinum resistance, and so this would ultimately allow for individualized risk profiling and treatment selection. When it comes to our methods, we looked at 158 H&E stained whole slide images. This represented 85 unique patients, and we had about 71% sensitive and 29% resistant in our cohort. When it comes to the study design, we did image processing with the CLAM deep learning framework and the Conch visual language foundation model. It kind of patched up all the images into 256 by 256 pixels, and then we did feature extraction as well. And then when it comes to the feature extraction with these patches, it's very loud and noisy, so we did custom patch isolation using natural language. So we kind of looked to see which patches were more likely to be representative of malignancy than not, and then we decided to use those patches for analysis. We did UMAP and clinical analysis using two-tailed tests and chi-square tests. Ultimately, when it comes to the image level predictive ability of the predicted sensitive patients in the validation cohort, 79% did actually show platinum sensitivity. When it comes to patch level accuracy, we had moderate level of an accuracy with identifying sensitivity. Training was 69%, validation was 65%. And then when we looked at the clinical correlation, the predicted resistant patients were significantly older, as well as more frequently higher stage. Ultimately, what we would like to do is to look at the known clinical predictors of platinum resistance, like the CA-125 and the extent of residual disease outside of reduction. And we also want to evaluate the relationship between histopathologic and radiology imaging correlates that are used to identify these tumor response types.
All right, thank you.